Nurses are the backbone of our healthcare system, working tirelessly day and night to keep our communities healthy and safe. They are often the first faces we see in times of crisis, and the last to leave when the work is done. Providing care and comfort at the bedside every day, nurses offer not just medical expertise, but also compassion, reassurance, and hope to patients and their families. Their presence is a source of strength in moments of vulnerability. Yet, the U.S. faces a historic nursing shortage, straining hospitals and clinics nationwide. The causes are many: an aging workforce, pandemic burnout, and a growing demand for healthcare as our population ages. Nurses are being asked to do more with less, leading to exhaustion and high turnover. The high cost and rigor of nursing education add to the challenge. Many aspiring nurses struggle to balance demanding coursework, clinical hours, and the financial burden of tuition and living expenses. Nursing schools are essential to rebuilding our workforce, but advanced degrees require years of training and significant financial investment. Without support, many talented students are forced to abandon their dreams of becoming nurses. If the path to becoming a nurse becomes too difficult or expensive, the consequences will be felt by everyone who relies on healthcare. Fewer nurses mean longer wait times, overworked staff, and ultimately, a decline in the quality of care. Now, a new legislative change threatens to make that path even harder. Lawmakers are debating policies that could reshape the future of nursing education and access. The One Big Beautiful Bill Act, signed this July, is set to overhaul the federal student loan system. This sweeping reform will affect how students pay for their education and who can afford to pursue advanced degrees. While aiming for fiscal responsibility, the law could have devastating consequences for the future of nursing and patient care in America. Many fear it will make nursing education even less accessible, deepening the shortage. Understanding this change is crucial, as its impact will reach far beyond university walls. It will shape the future of our healthcare system and the well-being of every patient who depends on it. The health of our nursing education system is directly linked to the health of our communities. Supporting nurses today means a healthier, stronger nation tomorrow. For years, graduate students have depended on the Grad Plus loan program as a crucial financial lifeline, allowing them to pursue advanced degrees without being limited by federal borrowing caps. This program enabled students to cover the full cost of tuition, fees, and living expenses, making graduate education accessible to many who otherwise couldn't afford it. But now, a sweeping new law has changed the landscape. Grad Plus will be eliminated, and in its place, strict annual and lifetime borrowing limits will apply to all graduate and professional students, starting in July 2026. This marks a significant departure from the previous system. Under the new rules, graduate students will be able to borrow up to $20,500 per year, with a maximum lifetime cap of $100,000. This is a substantial reduction for many, especially those in longer or more expensive programs. For professional students, such as those studying medicine, dentistry, or law, the caps are higher, up to $50,000 per year, with a $200,000 lifetime maximum. These fields are recognized for their high costs and the critical roles they play in society. This new tiered system is designed to balance the need for access to advanced education with the government's goal of controlling federal lending and reducing student debt burdens. However, controversy has erupted over how these categories are defined, and more importantly, who is excluded from the higher borrowing limits. Many students and educators are questioning the fairness and long-term impact of these decisions. Only certain fields, specifically those deemed professional by the government, qualify for the higher loan caps. This leaves out a wide range of graduate programs, from social work to public health, that also serve vital roles in our communities. The decision about which fields are included and which are not sits at the heart of a growing debate. Critics argue that these choices could reshape the future of our healthcare workforce and other essential professions, potentially leading to shortages in key areas. The new rules represent a fundamental shift in how the government values and supports advanced education, signaling a new era in federal student lending policy. For those professions left on the other side of the line, the implications are profound, potentially limiting access to graduate education and changing the makeup of our future workforce. The new federal loan caps for graduate students hinge on a critical question that's more complicated than it first appears. What exactly counts as a professional degree, and who gets to decide? This distinction isn't just academic, it has real financial consequences for students across the country. Under the new rules, only 11 fields, including medicine, dentistry, law, and clinical psychology, qualify for the higher federal borrowing limit, which can be crucial for covering the steep costs of these programs. But advanced nursing degrees, such as the Master of Science in Nursing and the Doctorate of Nursing Practice, are notably excluded from this list, despite their rigorous training and essential role in healthcare. This means that future nurse practitioners, nurse anesthetists, and nurse educators, who often face tuition costs similar to those in medicine, are subject to a much lower $100,000 cap on federal loans, making it harder to finance their education. The decision creates a frustrating and arbitrary hierarchy, suggesting that advanced nursing education is somehow less valuable or less demanding than other healthcare professions, even though these nurses are vital to patient care. In reality, advanced practice nurses perform many of the same functions as physicians, especially in primary care settings, and are often the main providers in underserved communities. Other essential fields, like physician assistants and physical therapists, are also excluded from the higher cap, despite their critical roles in the healthcare system and the high cost of their training. The new regulations threaten to create a two-tiered system of healthcare education, where some students can access the resources they need, while others are left struggling to make ends meet. For nursing, a profession that is predominantly female, this exclusion feels especially misguided and unfair, raising questions about equity and the value we place on those who care for us. Capping nursing student loans at $100,000 creates immediate barriers. The cost of advanced nursing degrees often exceeds this limit, especially when factoring in living expenses. Students will face significant funding gaps, forcing many to seek private loans with higher interest rates and fewer protections. Those without wealthy cosigners or perfect credit may be shut out entirely. This threatens to make advanced nursing education a privilege for the wealthy, not a path open to all. The result: a less diverse nursing workforce, and fewer nurses from underserved communities. The timing is especially bad, as we face a shortage of nursing faculty, who must have advanced degrees. Fewer nurse educators mean fewer new nurses entering the workforce. The loan caps threaten the entire educational infrastructure our nursing supply depends on. Nursing leaders warn that these new loan caps are a dangerous misstep for patient care. Jennifer Mensick Kennedy, president of the American Nurses Association, says, "Limiting nurses' access to funding for graduate education threatens the very foundation of patient care." Experts predict the caps will reduce the number of nurses pursuing advanced degrees, worsening shortages of nurse practitioners, specialists, and educators. The core argument, classifying nursing as a graduate, not professional, field, ignores the advanced skills and responsibilities of these roles. Nursing organizations are lobbying Congress and the Department of Education to reconsider. They argue the exclusion is based on an outdated view of healthcare professions. This is not just a policy debate. It will impact the health of millions of Americans. The fight is for the future of accessible, high-quality healthcare. The government sees the new loan caps as necessary to address the $1.7 trillion federal student loan crisis. Officials argue that unlimited Grad Plus loans allowed tuition to rise unchecked. The new caps are meant to instill fiscal discipline and protect both students and taxpayers. The Department of Education says the definition of a professional degree follows historical precedent and was determined through a negotiated process. They frame the policy as a tough but necessary decision to control costs, not to punish any field. The distinction is seen as a practical tool for managing financial risk, favoring fields with higher earning potential. While nursing's importance is acknowledged, officials say the classification serves the broader goal of fiscal responsibility. The department is focused on reining in debt, even if some fields face new challenges. The impact of these loan caps will ripple through the entire healthcare system. Hospitals may have fewer qualified nurse leaders, risking declines in care quality and patient safety. Patients could face longer wait times and less access to primary care, especially in rural and underserved areas. Nurse practitioners are often the only providers in these communities. Financial barriers could cut off this lifeline. The policy could turn healthcare deserts into a permanent reality. The U.S. may become more reliant on foreign-educated nurses, which is not a sustainable solution. Increased competition for fewer nurses will drive up costs and strain the system. The result? A less stable, more expensive, and less equitable healthcare system. Some analysts argue the impact of the loan caps may be less severe than feared. Data shows the typical debt for a doctorate of nursing practice is around $70,000, below the new cap. Many students may still complete their degrees without hitting the limit. The policy could pressure high-cost programs to lower tuition, making education more affordable. However, averages can be misleading. Students in expensive programs or high-cost areas could be blocked. Those from less privileged backgrounds are most at risk. The debate isn't just about the average student, but about who gets left behind. Are we willing to sacrifice future nursing leaders and educators? As of November 21, 2025, the policy is not yet final. The Department of Education is accepting public comments on the proposed rules. This is a crucial opportunity for nurses, patients, and advocates to make their voices heard. The department must consider this feedback before finalizing the rules. Nursing organizations are lobbying Congress and mobilizing grassroots campaigns to push for change. The goal: persuade the department to include advanced nursing in the professional category. The clock is ticking. The rules are set to take effect July 2026. The coming months will determine whether advanced nursing education remains accessible. The outcome will shape the future of our healthcare system. The decisions made now will soon be felt in hospitals across the nation.